This product, X-Treme Freeze 4% Topical Gel, has different uses depending on the brand. Some brands are used to treat minor aches and pains of the muscles and joints, like arthritis, backache, and sprains. Other brands are used to help relieve itching and skin irritation caused by sunburn, insect bites, or minor scrapes. The active ingredient, menthol, works as a counterirritant by causing the skin to feel cool and then warm. It is recommended to apply a thin layer of the gel to the affected area no more than 3 to 4 times a day. It is best to use it as needed or as directed by your doctor. When using X-Treme Freeze 4% Topical Gel, it's important to follow the directions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. This medication is for use on the skin only. Apply to the affected area no more than 3 to 4 times a day. If you are using the cream, gel, or liquid, rub in gently and thoroughly. Some liquid forms of this medication should be shaken before use. Let the medicine dry completely before letting anyone else touch the area. It's important to wash your hands well after applying unless you are using this medication to treat the hands. Avoid getting this medication in your eyes, nose, or mouth. If you do get the medication in those areas, flush with plenty of water. Do not apply to serious burns or deep wounds. Do not bandage or tightly wrap the affected area. Doing so may increase the risk of side effects. You may cover the area loosely to protect clothing. Avoid applying this medication right before, during, or after activities that increase skin temperature, such as bathing, swimming, or heavy exercise. Wait until your skin has cooled before applying the medication. Do not use a sunlamp/tanning bed, hot water bottle, or heating pad/device on the treated area. Check the label for the ingredients, as the manufacturer may have changed them. Also, products with similar names may contain different ingredients meant for different purposes. Read the label carefully to make sure you have the right product for you. Ask your pharmacist if you have any questions. If your condition lasts for more than 7 days, gets worse, or keeps returning, tell your doctor. If you think you may have a serious medical problem, get medical help right away. If you experience redness, warmth, or irritation at the application site, it's important to let your doctor or pharmacist know. However, many people using this medication do not have serious side effects. It's important to stop using this medication and tell your doctor right away if you experience blistering or swelling at the application site, or increased or unusual pain. Although a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. Remember that this is not a complete list of possible side effects, so if you notice any other effects that are not listed, be sure to contact your doctor or pharmacist. And if you have any concerns or questions about the side effects, don't hesitate to reach out to your healthcare provider for guidance. Before using X-Treme Freeze 4% Topical Gel, make sure to inform your doctor or pharmacist if you are allergic to menthol or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to discuss this with your pharmacist for more details. Additionally, it's important to inform your doctor or pharmacist about your medical history before using this medication. If you are planning to have surgery, make sure to let your doctor or dentist know about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed, so it's crucial to discuss the risks and benefits with your doctor. It's also important to consult your doctor before using this medication if you are breastfeeding, as it is unknown if the medication passes into breast milk. It's important to be aware of potential drug interactions when using X-Treme Freeze 4% Topical Gel, as they can affect how your medications work and increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. This will ensure the safe and effective use of X-Treme Freeze 4% Topical Gel. If this medication is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like passing out or difficulty breathing, it's important to call 911 for immediate help. Otherwise, reaching out to a poison control center is essential. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while residents in Canada can call a provincial poison control center for assistance. Make sure to use X-Treme Freeze 4% topical gel as directed by your doctor. It is for external use only. Clean and dry the affected area before applying the gel. Apply a thin layer of the gel to the affected area and rub in gently. Do not cover the treated area with bandages or wrap it unless directed by your doctor. Wash your hands after applying the gel unless your hands are the treated area. Do not apply the gel to the eyes, mouth, nose, or genitals. If you do get the gel in those areas, flush with plenty of water. Use this medication regularly to get the most benefit from it. To help you remember, use it at the same times each day. Do not use large amounts of this medication or apply it more often than directed. Your condition will not improve any faster, and your risk of side effects may increase. If you are using X-Treme Freeze 4% topical gel on a regular schedule and forget to apply it, just apply it as soon as you remember. If it's close to the time of your next dose, then just skip the missed dose and apply your next dose at the regular time. Do not apply double the dose to make up for the missed one. When using X-Treme Freeze 4% topical gel, it is important to store it at room temperature. Different brands of this medication may have different storage needs, so be sure to check the product package for specific instructions or ask your pharmacist for guidance. It's also important to keep all medications out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. As for the benefits of X-Treme Freeze 4% topical gel, it can be used to relieve muscle and joint pain. The recommended dosage is to apply a thin layer of the gel to the affected area no more than 4 times a day. It is best to use it at the first sign of pain to achieve the maximum benefit. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.